choose the night, blah, blah.
The thing is, guys, we're live now, so everyone, but that's fine. We're real people. So hello, everybody who's with us now, or if you're watching this later, listening to this later, thank you for joining us today. This was quite the meeting that we're having now wasn't planned much in advance. And so we're just kind of getting together with our good feelings and thoughts and excitement about an event that is coming up in Denmark soon. And it's all about largely about two specific epilepsies called SCN2, I forget them both. What are they called again?
SCN2A and the SCN8A.
That's right. Okay, cool. And we have some wonderful mums and dads here today who are going to tell us a bit about their lives with their child and their involvement in this exciting conference, which is happening next month. And actually, it's got a real involvement with Philadelphia with an F as well, if you guys want to check those out. I will provide a link to the event in the text below our chat, so you can all check that out. So going first, because this had been agreed, Cinzia, could you tell everyone a bit about yourself, please, and what you do and why you're here?
Okay. So I'm based in Milano. I'm from Italy, and I set up the first European organization in Italy in 2020, and also was one of the main organizers of the first conference dedicated to SCN2A and SCN8A that took place in Bonn, Germany in 2021. So this is just next month, we're going to have the second edition of this conference. And so we are really excited because it's a dream that comes true, because we wanted to have something in Europe dedicated to this very specific, very rare epilepsies.
Mm-hmm. And so have you been managing this event sort of from the beginning then, really, working with the clinicians and researchers?
Yeah. So, so it was really, a partnership with the clinicians and researchers. So every presentation has been discussed between us. So it's just great.
Wonderful. And tell us just a little bit about your background and the presentation that you're going to be doing at this conference. Tell us about your angle on things.
Okay, so I'm going to present a little bit about the needs, the unmet needs of rare families, and with a specific focus on SCN8A epilepsy as well as SCN8A families. And I will present a little bit the SCN8A history. So starting from the first case that was diagnosed in 2012 by Dr. Hammer, and now where we are. So actually, it's 10 years of history, very squeezed in 15 minutes probably, and and so how as a patient advocates we're trying to address the unmet needs that families have, and what we can do better, where we can improve, how we can collaborate more. And this is more or less the topic.
Thank you so much. And so Gaby, do you want to tell us a little bit about yourself and your family and your story and the part you'll be playing?
Sure. I'm Gaby, and I live in the Netherlands together with my husband and my two kids. And my youngest daughter, Senna, she is diagnosed with SCN8A. She was starting having seizures when she was 4 months old. Mm-hmm. And now she is 23 months old. And she also has a mild development delay. Mm-hmm. But her seizures are quite heavy. Every seizure, she ends up in hospital with a status episode. And that is unfortunately, because that is also the reason why I cannot participate in Denmark, because she's not stable enough to travel abroad. So I will follow from a distance, of course. And in July 2022, we established SCN8A Nederland, so the Dutch patient organization, and well, I was in doubt, but Cinzia convinced me to do so. And there is another mom, Marijke Jacobs, and we did it together. And then we have several patient organizations in Europe now, and we decided to, how important is collaboration. Well, with such a rare disease as SCN8A, we believe that it is really important to collaborate with the whole world to find a cure, to move mountains. You know, with the all of us, we are much stronger. We have much more knowledge. So that is the reason why we decided to establish the European Federation, which is a really, really good thing for Europe and for SCN8A. And actually, Cinzia, Gregori, and myself did it with the three of us at the beginning. Or we are the board, as it's called. And we established it the 9th of February this year. And the 9th of February is for SCN8A a special day, because that is SCN8A Awareness Day.
Yeah.
So we thought that is a good day to establish this federation.
Lovely, thank you so much. And what about you? And I apologize, everyone, if I'm pronouncing your names incorrectly. But Gregori, could you tell us about your role in this conference and your background and
perfect pronunciation. So I am the father of Joachim. He's 8 years old now. We are lucky because he's stable, and he's stable since 1.5 years old.
Oh, great.
So we are very, very lucky. And so when I went to the last reunion, that was 1 year ago, 1.5 years ago, met Cinzia, that impulsed the energy to create all the federations in Europe. Thank you for that. And so we created the French Federation, the French Association, and with two moms that were already creating a Facebook group. And our first 1.5 years, the main objective was to make people be aware of the association, to show what we are doing, to make hospital communicate to the patients, subscribe to rare disease in France, to Epilepsy French organization, etc. So all the I would say lobbying, but make people aware that we exist. They can contact us. We can support them, etc. And also, I am part of the European network for patient advocacy. So that is supporting the EPAG committee.
Oh, brilliant, for EpiCare.
Yeah, exactly.
Great.
Exactly. But I'm just starting, so it's very new for me.
Okay.
So step by step, I'm learning to know how to help patients in the European organizations.
Thank you. It's lovely to have such similar-minded, similar-thinking people come together from around Europe who want to achieve, basically the same thing. Have you, I don't know, give us some like random facts about why, or why other people who are not affected by this rare epilepsy, why they should be interested in what you're doing. Because I find it fascinating just from a genetic and scientific perspective, but why else might somebody else be interested, do you think? That's for anybody.
I'm not one of the parents that is more implicated, but our SCN8A disease has a difficulty to find a cure that can be used easily, because if you talk about sodium channel voltage molecules, the medicines that currently exist are going to block everything. And for our disease, sometimes the medicines that you have to give are too much for the little patients. They suffer for this, and sometimes I know that we use what they call over-therapeutic doses. We are over the charts. That's the only way to stabilize. And so we are trying to find other medicines that could be more specific and that could not have those side effects.
Oh, well, I certainly empathize personally. I mean, I don't have either one of these diseases, but I have an epilepsy personally, and I certainly know what it's like to feel like you're overdosed daily on these medications. Exactly. And they like affect you cognitively, they can affect you mentally, emotionally, your relationships. And I know, especially for when you're very little or a baby, and then you're starting these, they affect your cognitive development and everything, to put it politely. And I think, you know, for anybody who's not yet overly aware of the rare epilepsies or anything to do with, you know, sort of genetics or neurology or neuroscience, realize that these are sort of diseases that can affect anybody that you know at any one point. Exactly. These are, you know, people, when I think generally I find, and I used to think this personally, I assumed that anything genetic was something that you got from your mum or your dad. And and that if your mum or dad had a gene, you would instantly get it. And that could not be further from the truth. And I believe with this specific disease, it's down to a mutation, is it?
Yeah.
So it's not like anybody else in the family had it. And so it's completely unexpected, I imagine.
Yeah,
exactly.
almost the most people until now known with SCN8A are de novo. So the first one with the mutation. Yeah. So that's also a proof that it can happen to anyone.
Exactly.
Yeah.
I sometimes wonder, and this is why we need conferences like this, so anybody, if you're not attending, you're missing out, but that you find out that there are so many similarities between people with the same diagnosis, but also often many differences, right? Yeah. So you can have one gene that is supposedly responsible for this disease, but it can affect everybody so differently. Would you say that's the case in this disease?
Yeah, definitely. Yeah, because SCN8A actually is a spectrum, so there are very different phenotypes from a very benign to very, very severe cases. And so I believe, I mean, coming back to your question, Torie, that this conference, I believe, is very important because it's going to give to clinicians, because there will be also lots of clinicians attending from all around Europe,
even the US.
Yeah, also US, because I mean, they're going to the conference. We're going to update the clinicians with the most innovative researchers in the area. So we're going to understand more, because the aim is going is to go in very, very deeply into the understanding of the disease. And as Gregori said, also we want to collaborating with researchers and also the pharmaceutical representatives that will be there attending in person, achieve a cure. So that will be not just, addressing the symptoms, but also being a disease modifying. So this will be, the goal. Yeah.
Yeah. And so I think things have changed a lot actually over by the way, we had questions lined up and I'm completely going on a tangent, so apologies. But I think things have changed significantly, say over the last sort of 10 years, even when it comes to genetic epilepsies and anything to do with genetics. And from my perspective anyway, and I'd like to know if you agree or disagree, or it seems there's much greater involvement these days with families, directly with the scientists, researchers and clinicians than there used to be. Do you think that's the case? I mean, I wouldn't have seen you guys or myself at this event maybe 10, 20 years ago.
Yeah, I agree, because previously, I think that we were not knowing what the epilepsy was from. So we are just an infantile epilepsy, an adult epilepsy, and some subdivisions in there. But it was difficult to find what was the root cause of it. And now we have genes, so we know exactly what it comes from, which is at first very comforting, but because we know why. For families, at least, we know why. And now we have genes, so we know exactly what it comes from, which is at first very comforting, but because we know why. For families, at least, we know why. And but the difficulty is that, as you said, it's only 5-10 years that we know these genes, and they are not in the panels for detecting. So we are building a community of patients as we grow, and that's why we contact the hospital so that they can contact us. We can have a panel, we can have information that we can give to clinicians, etc. We are this link between the clinicians and the researchers and the families to help gather as many information as we can.
It's exciting stuff. And would you say that you also help sometimes direct where the research is going? So sometimes you'll have an academic or scientist who presumes a certain thing. We all do this. We presume something because we don't know the full spectrum of a disease or what a project. And sometimes, people I've spoken to have said that being involved with mums and dads and families has actually really helped them become more precise in how or what exactly they need to research and what they need to focus on in their work to help patients long term.
I personally, I don't work as much with clinicians and researchers to answer this question, but for hospitals, we know now that some medicines that are used for epilepsy should not be used. And that's information that we can give to other mom and dads so that they can give it to the doctor saying, no, I know this one, please, we don't have to stop trying because we know that if it has this side effect, we should stop and we should try another one. We know that some medicines are not working, and that's because of the communication, because we communicate together, and that's important. But for researchers, maybe Cinzia, you have some more.
And also, another thing that just comes to my mind is that the main endpoint that also is the one that is going to be assessed in clinical trials are only the seizures. But beyond the seizures, we have lots of more other aspects like cognitive functions and motor skills, and also sleep disorders or movement disorders. So, a drug that can maybe not seems to be efficacious to treat seizures can be great for, improve the quality of sleep or improve the quality of life in general of the kid and also the family, the whole family. So it's also important to consider the whole thing and not just seizures that are really, really important in SCN8A to achieve a control, but it's not just seizures.
That's so important. You know what? I did a talk for a pharma company the other week, and I said basically exactly the same thing. So even as a person without this specific epilepsy, I said sometimes the priority isn't the seizure control. It can be many other parts of a person's life. And these are little people, they deserve quality of life. And it's sometimes hard to, I guess, especially with children, especially if they have problems or challenges communicating, to figure out what is affecting their life more considerably, what things are affecting them more negatively than, say, another thing. And I guess that's where sometimes having a mum and a dad involved, or one or the other involved, you can actually communicate priorities to the clinician, I would say, better than the patient a lot of the time.
Yeah. Agreed.
Yeah.
Well, they're lucky to have you, your mums and dads being so involved and fighting their corner. And Well, actually, you're not even solely fighting the corner of your own child, are you? You're fighting the corner of, largely, at least at the moment, families affected in Europe, and that's a really, really big deal. So I thank you very much. If anybody would like to get in touch with you guys, how would you like that to happen? Is it via a website? Is it via Facebook? Or each of you, one after the Cinzia, what's the best way to get hold of you?
Yeah, so we have a Facebook and Instagram page dedicated to, it's called SCN8A European Federation.
Mm-hmm.
And then we have also all the local social networks dedicated to the different organizations. So we have the Netherlands, we have the French, so SCN8A Netherlands, SCN8A Italy, SCN8A France. And also we have SCN8A España, SCN8A Portugal, and SCN8A UK and Ireland. So you can also contact, depending on where you are located, you can also contact the different organization, but we are all connected. So you can choose.
That sounds like the question's been answered for you, Gaby and Gregori.
Yes.
So like, thanks. Okay, wonderful. All right. Well, thank you so much for just giving us a little bit of insight into your lives, but also the value of this conference that's coming up. And it sounds like you've waited a couple of years for this, and I can't wait to meet you there. Well, I unfortunately won't get to meet you, Gaby, but hopefully at some point.
Maybe next time.
Yeah, fingers crossed. Yeah, fingers crossed.
We hope for stability by then.
Yes,
yeah,
indeed. Okay, guys. Well, again, thank you very much, and I will speak to you all soon. Thank you.
Thank
Thank
you.
you very much.
Thank you. Bye.
Thank you. Bye-bye.